Hi, it's Jeanette, and we're back with the Lube Tube, and it's myself and my co-host, Brittany.
Hey guys, still here.
I'm really excited about this episode. And this episode is brought to you by Celebrations Bridal and Prom, providing big city style and small town service since 1988. This episode, we're going to learn about a lot of things, but the most common question that I get every day is, do we really need an annual exam every year? So that's what we're talking about today, the annual exam. Brittany, did you get your annual exam this year?
It's about to be scheduled after this podcast, actually. This is not a lie, actually.
Brittany. Brittany.
It's been a busy year.
Okay. Okay. So I think it's important that we talk about this because even really educated women like Brittany, who is a physician assistant, still has not gotten her annual exam because maybe she says she's busy, but maybe there's other things that are keeping her from doing that. So I think it's important that we talk about that. Okay?
Yes, ma'am. Let's get going.
All right. So let's talk about the significance and the importance of a regular well woman exam. You know, well woman exams, when we talk about that, it's where you go and see your provider, whether that's your physician assistant, or your nurse practitioner, a qualified medical provider that can go and take a look and examine and take a history and talk about all the things that are important to your body. It gives you an appointment where you literally sit down and you talk about just yourself and they ask you questions about your body. With this exam, it's important that we talk about, are you up to date on your screenings, right? Have you had your mammogram if it's due? What about colonoscopies or colon cancer screenings? Do you need a pap smear? And what was your last pap smear? And when was that last pap smear? So I think it's important that these are done, yes, annually, because even if you do not have a cervix, which is basically the opening of your uterus that we do cervical exams or pap smears on, you still need an annual exam because we still do a pelvic exam. That pelvic exam looks for things like vaginal cancer, right? It looks for certain abnormalities of the pelvis, like pelvic floor dysfunction. But there's a lot of things that we can get out of this annual exam that I think a lot of women think that they are not necessary. This is a question I get every day, multiple times a day, actually, when the lady comes in and says, okay, Jeanette, I'm here for my annual exam, but do I really need to do this every year? Right? And my answer is yes. I do think that every single woman needs an exam with a provider who's going to take a really good history, make sure they're up to date on their screenings, and do a good exam. I mean, I know a lot of women that don't do an annual exam. Maybe they go see their primary care, but I don't know about you, but my primary care has never done a breast or a pelvic exam on me.
No. And I mean, I have those same patients that come in for their hormone replacement. And one of the prerequisites that we have with hormone replacement is we need to have an annual. We need to have a mammogram if I'm going to be giving you any hormone replacement. And I get the same question. Well, I don't have a uterus. Why do I have to get an annual exam?
Right.
And I give them the same spiel you did.
Right.
Maybe yours sounds better than mine.
I doubt it. I seriously doubt it.
So, I mean, it's a universal thing, definitely.
Absolutely. Absolutely. I think it's also important to talk about when a pap smear is actually due. So I'm 40. I'm going to be 41 in 2 months.
Whoa.
Oh my gosh.
I didn't mean it like that.
Oh,
you
yeah.
look so good.
You are so kind. Thanks for that. Yes, I will be 41. And I remember that I got my first pap smear at I think I was 16, maybe 17. But that's not the recommendation anymore. And the amount of women that come and see me, like older women that have maybe teenage daughters and that are asking me, hey, when should I bring my daughter in, right? When does she need her first pap smear? And honestly, they're surprised when I tell them the answer because it's actually 21 years old.
Okay.
Do you remember when you got yours?
It was probably around that time. I think, and you can correct me if I'm wrong, but I think back in the day, it was really like when you're sexually active, you go and do that. So,
but how embarrassing is that for maybe a younger girl that says, "Hey, mom, I'm sexually active now. Let's go get a pap
Well, they're
smear."
not going to tell their mom.
Nope. Exactly.
It's not going to happen.
Exactly. So there's a organization that's basically, we call it ACOG for short. And basically, it's a obstetrics and gynecology organization that kind of gives us rules to follow. And we'll get to that here in a little bit, but talks about when you should have what and why you should have what. And kind of that's what we follow as medical providers and who we should screen. But I also think it's really important to say that not everybody follows those recommendations. There are some providers that say, I don't feel really comfortable waiting 3 to 5 years to pap smear a patient, so I'm going to do it more frequently. And I think that's a discussion that is for you and your provider. I don't think that's a discussion that we could say, hey, this is how it is, and you just follow that. I think that's going to be dependent on the patient for sure and their medical provider and what they choose to do. It's also important that, so say that our ladies are, our Medicare ladies, so they're 65 and up, right? And Medicare only covers an annual exam, but every 2 years usually, which is frustrating, right?
That is frustrating.
I have so many ladies though that say, you know what, screw it. I'm coming every year. And they might or might not get a bill for that annual exam, but I love that they still come see me yearly because they feel that they need that exam. And I think that's important. So what is a pap smear? So a pap smear. I think a lot of us think that a pelvic exam is a pap smear, right? Which they're actually two different things. So a pelvic exam is where, as a provider, we use a tool called the speculum. Oh, right.
Ooh,
I know.
know.
Why are those things so awful?
They just look scary, right?
Why?
Like maybe if they didn't look so scary, people wouldn't be so
afraid of them?
Yes.
Well, why do they make that awful noise? Like when I examine my patients, I try to not make the noise, like the clink, 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 and the where you try to make it tighter and open it. And I try not to make those sounds because I feel like that in itself is anxiety, right? Oh my God, I hate that sound. There's a lot of providers that use plastic speculums.
Yes.
I personally don't, just because I can't, I feel like I can make the exam a lot less painful with a metal speculum than a plastic speculum, but that's obviously provider dependent.
Right.
But anyways, so a pelvic exam is actually where we look at the outside of the vaginal area. So we're looking at the labia, we're looking at the clitoris, we're looking at the mons, which is the upper top of the pubis. We're looking at the perineum. We're looking at all those areas. We're looking for vaginal cancer, right? We're looking for maybe a mole that you've never noticed before because not everybody looks down there, right? A lot of people don't look down there. We're looking for signs of what we call atrophy, which happens when we lose estrogen. And we're looking to see if we can help ladies with that. And then the next thing we do is then we place that speculum inside that vagina. And I think it's important that, even myself, we're going to tense up, right? But the best thing you can do for that pelvic exam is try to relax as much as possible. And so like I always tell my patients, relax that booty muscle, And I'd actually touch the booty muscle to try to get them to calm that down because then that relaxes that pelvis. The sooner you do that, the less painful this exam is going to be for you as a female.
And just for clarity too, there's more than one size for a speculum.
That's right.
And
that is so true.
When you see the largest size, don't be scared because there are different sizes.
Oh, yes.
And I know they're picked accordingly.
That's right. So. We have little bitty ones. Those are kind of like what we call the pediatrics, but we can actually use this on any lady, right? And then we have larger speculums especially for doing big procedures that require a little bit more room to see everything in the pelvis. But our first goal, and when we're doing these exams, is not to grab the biggest speculum. We actually try to go as small as possible because we don't want to hurt you, right? So as far as the pelvic exam, once we do that speculum and we place that speculum, we then open it up. And what we're looking for, so say you have not had a hysterectomy. And a hysterectomy, if you don't know, is where we go in and actually remove the uterus altogether. Prior to recent surgical procedures, they were actually leaving the cervix. So they would remove the whole uterus and leave the cervix. There's a lot of mixed reviews on why that happened and why they did that. But with this type of hysterectomy, you actually still need pap smears, right? Just because you've had a hysterectomy, if you've had a hysterectomy that they left the cervix, you still need a pap smear, right? So that's important that we do that. And then what we're looking for is that cervix, and we're looking for cervical changes, right? What does that mean? We're looking for redness or bleeding or irritation or maybe even a mass or a polyp that we can see on that cervix. And then we take a brush, and it's basically looks like literally a little broom, and we brush that cervical wall, and we're looking for cells, right? So when we take that out, then we send it off to the pathologist, who is a specialized physician who looks at all of those cells underneath the microscope, and they're looking for abnormal cells. cells, okay? And those abnormal cells meaning precancerous cells or even cancer cells. Once we're done with that part, we remove the speculum and place it to the side. And then we do what we call as a bimanual exam, okay? A bimanual exam is where we place one finger in the pelvis and we examine both sides, like each side of the pelvis, checking to see if I feel any masses or any fullness or any pain in your pelvis that could tell me that maybe you need a further workup. That part of the exam is really important, right? It's checking a lot of things rather than just a pap smear. So if you've had a hysterectomy, you still need that exam because there is vaginal cancer, right? It's a real thing. There's ovarian cancer. There are things where that pelvic exam can tell us a whole lot. The primary goal of the pap smear is to detect cervical cancer, right? That's the actual pap smear itself. These pap smears, they're really good at detecting things. And from there, we can kind of do, if we get an abnormal result back, we can kind of do what the next step is, whether that is another procedure called a colposcopy, or if it's a wait and watch, and kind of see if we need further screening. So who needs these, right? Like we mentioned a little bit earlier, it's like, who needs a pap smear? There's a lot of physicians that follow the ACOG, right? The recommendations. And those recommendations that your first PAP is at age 21, okay? And that's without HPV testing, okay? And then ages 21 to 29, those PAPs are done every 3 years. And then ages 30 to 64, there's a pap smear, but with HPV co-testing. So what that means is along with the pap smear, we're also testing for HPV, or the virus that can cause cervical cancer, which is the human papillomavirus. If that is done, the co-testing is done every 5 years. So not getting a pap smear, but every 5 years with that HPV testing. If the HPV testing is not done, then the recommendation is just the pap alone every 3 years. So that can get really confusing, right?
Mm-hmm.
So it honestly also, it depends on what if your pap smear comes back abnormal, right? So say the HPV is negative, great, right? But the pap smear is abnormal. Well, what, right? So then ACOG has other recommendations off of each of those independent results. And we have a whole basically guideline to go by with that.
Right. But again, as a reminder to everyone, this is really provider dependent. There are certainly people that follow these guidelines.
Absolutely.
But your provider may not be one of those people.
Right.
So you just got to trust them, or you have to find someone else that is following these guidelines.
Right. Absolutely. And there are some providers that say, you know what, I don't feel comfortable with waiting every 3 to 5 years. I still want to do a pap smear on every single patient that walks in my door. There are a lot of providers that do that. And I think it's provider dependent. It's patient dependent. When I see my patients, I basically talk about these recommendations. There are a lot of my patients that say, no, I still want to do a pap smear. So I still do a pap smear yearly on them. Then I have other patients that are like, no, I'm fine with following the recommendations. They're there for a reason. And I kind of give them that choice and make sure that they're educated on that before they make that choice for themselves. But what I find is really crazy is after 65, no more pap smears. Not a single one, right? Wow. I know. So I guess that's also a decision that you need to make with your provider. So basically, if there's no history of abnormal pap smears for the 65 and up, and they've had normal paps throughout their whole life, recommendation is to stop. No more pap smear testing. But they also have to have 3 negative HPVs in a row before we can make that decision. And so that's going to have to be something that obviously is patient dependent, and it's going to be different per patient, right? If there's any history of precancer cells or cervical cancer, you definitely want to continue with pap smears for the next 25 years, even if they're over 65, okay? So say a patient has a history of cervical cancer and they had a LEEP, right? Where they actually go in and remove that cancer part of that cervix. I still pap those patients.
Okay.
Absolutely, because they are obviously at higher risk. There's also something that I think a lot of people don't talk about. It's something that kind of like our moms were exposed to, but our moms were exposed to them while they were in utero, right? While they were a baby. And that's a medication that was given called DES, okay? DES was basically a synthetic estrogen that was given to help kind of prevent miscarriage, and actually was given for a lot of different reasons. But there's actually an increased risk of cancer with these patients. And so it's a different type of cancer for the cervix. But that's a good question to find that out if you were exposed to DES while you were in utero. Because if you were, then you still need a pap smear, right? Because it's actually a different type of cancer that we're screening for. So I do think that's an important question that you ask and that you find out about your own health.
Absolutely.
So also, like, what does it mean, right? I had a normal pap. What does that mean? Well, that means that there was no cervical cells that showed cancer, right? That there were no changes in that cervix. There were no maybe even precancer cells that were detected. And, if that was negative, awesome, right? But the next step, our next question is was your HPV negative, right? HPV, like I said, is only co-tested when 30 and up, right? So if you are not 30, then what we normally order is a pap smear with reflex HPV testing. So say you come to me and you're 24 years old and you're getting a pap smear. Your pap smear comes back with abnormal cellular changes. Then I actually have the lab add on a reflex, right? Because then that tells me, okay, the HPV is negative. Okay, so this could be abnormal cells because of maybe an inflammation, like an inflammatory change, maybe like an infection, right? Or it's truly precancer cells, right? That are caused by possibly the HPV virus. So I think it's one of those things that, if the HPV is negative and the pap smear is negative, then I think absolutely following the recommendation, right? But I think as women, we're kind of nervous about that. I know I am. I'm personally nervous about that recommendation.
Yeah, that seems it's interesting. 30 seems like but maybe that's because people started getting the vaccination
Yes.
more, and they feel like, because I mean, for a while there,
Mm-hmm.
I feel like it was way younger than 30 where
Right.
people were finding out that, hey, they had HPV.
Right.
Right. But
Absolutely.
it might have been the generation that wasn't exposed
Vaccinated.
to it. Right.
Mm-hmm.
Yeah.
And then also, I think it's also the vaccination that is a part of that. I also think that, cervical cancer is actually a cancer that obviously we screen a lot for. So it's earlier detected and taken care of a lot faster rather than something that's not really screened for, like ovarian cancer, right?
Let me just throw some hypotheticals at you that I've certainly heard.
Okay.
So I've had patients that will say, I was HPV negative.
Mm-hmm.
I've been with the same person for 10 years.
Mm-hmm.
And now all of a sudden I'm coming back with HPV positive.
Mm-hmm.
Do I need to talk to my husband?
I know.
How do I explain this?
I know. That's something literally that I hear almost every day.
Mm-hmm.
And it creates a really hard situation for that lady, because then there's these thoughts that I've never had a positive HPV. Did my significant other cheat on me? Well, I mean, I would hate to think that that's what happened, right? But what we do know about HPV is that it does lay dormant, right? And viruses are weird, right? Viruses are smart things, and they can constantly change and hide from us. And then when our immune system goes down, like if you've recently been fighting an infection or stress or something that is causing your immune system to kind of plummet a little bit, that virus can rear its ugly head. And just because it's picked up on a pap smear and it's never been picked up on a pap smear before, that does not mean that you recently got that infection. You could have got that infection a really long time ago, and it's just never picked up because the body is excellent at trying to hide that virus and make sure it doesn't do what it's supposed to do as far as infecting cervix.
Well, and that's great to hear that.
Mm-hmm.
But I still think there's probably a lot of people that that's not a good enough answer.
I know.
And that can create a lot of
animosity and fear, and it honestly can wreck a relationship.
Right.
And there's no way to know when
exactly
you got that.
Right. There's no way to know.
Mm-hmm. There's no way to know. Yeah, there's no way to know. And like you mentioned earlier, the Gardasil vaccine, right? The Gardasil vaccine is a vaccine that's been around for quite a while. I actually did a research on HPV and the Gardasil vaccine and kind of the effects of the vaccine on mothers of teenage daughters and what their thoughts on were this vaccine. That was during my PA school. And it's actually an article out there that you can go and read. It's a really good published article. It looks at basically the attitudes towards the HPV vaccine during when it first came out and whether they should give it to their daughters. And a lot of people thought that, oh, if I give my daughter this, she's going to just go out and have sex. She's going to feel protected and she's going to have sex. Well, I don't think so, right? I mean, that's not my personal belief. You've now protected your daughter. You've protected your daughter from 9 different types of HPV that can cause not only cervical cancer, but we're talking about vaginal cancer. We're talking about some head and neck cancers. We're also talking about warts. Like warts are awful. And honestly, if you were to give her that vaccine, then it could protect her from 9 different strains of that virus that can cause that. Personal history. My 2 boys, they are going to be 12 and 14 next month. They've both been vaccinated with the Gardasil vaccine. And I recommend it for all boys too, because we don't just get it ourselves, females. Where do we think we get this virus? Right? So if we are sexually active with other males, then that virus is going between both of us, right? And same thing with same-sex couples, right? So I think it's important for both of them to be vaccinated, right? So I absolutely recommend the Gardasil vaccine because it does protect against those multiple things, not just cervical cancer.
Right. And when we were getting it in the early days, there was a certain time frame or age that could get it.
That's right.
And it was a very limited.
That's right.
Right. It was very limited.
Right. Now it's actually open to 45 years old.
Wow.
So I have ladies that maybe they come in and they have an abnormal pap, right? And now they have now tested for positive for HPV. I'm vaccinating these ladies, especially if maybe they're not in a monogamous relationship, especially if they are maybe even recently split up or are having sex with other people, then I do recommend that Gardasil vaccine because though their pap smears have been normal their whole life, that doesn't mean they're going to stay that way, especially if they're having sex with other people than they've had before. So
Right.
I think the Gardasil vaccine now being available to women and older people, men as well, can protect so many different people from HPV issues, right? So I think it's important to also talk about like general tips for reducing the risk of getting cervical cancer. I think it comes down to protecting yourself during intercourse a lot of times, right? So, I think it's important to wear a condom, right? Especially in a new relationship that, y'all are just starting out. If you're having sex with a male, then he needs to wear a condom. And until you know his status, right?
His history, yes.
And guess what? Do you think men get tested for HPV? They don't.
Mm-mm.
There is no annual test like we get every year for a male to test for HPV. And though we can test for other STDs, really in all my years, I've never tested a male for HPV unless they had a venereal wart, right? And then obviously you can send that off for HPV testing. But there's no pap smears for males. So we don't know what their status is unless they have an actual lesion, right? So protecting yourself, right? And just routine screenings, like the annual exam, right? Here we go again. And then vaccination, like we talked about. So yeah, I know a lot of people have common fears though about getting an annual exam. And there's so many misconceptions about the annual exam and pap smears, and I'm afraid to come and do it. And like, I don't know how many times I see a lady that maybe I hadn't seen her for 3 years. And she's like, I'm sorry, I haven't been back. I meant to.
But you're so scary.
Yeah, I am just so scary.
No, I think a lot of it has to do with number one is this is going to hurt.
Oh yeah.
I don't want to do this.
Yeah.
Like I can avoid it for another year.
Mm-hmm. Mm-hmm. But don't, right? You need to have the ability to tell them, hey, I'm nervous.
Mm-hmm.
And let them walk you through it, right? Yes, as providers, and as you very well know, as soon as we walk in the room, we start assessing that patient, right? And you can pretty much get a vibe on if that patient is extremely nervous or maybe they've put this off for a really long time. And so I really, I walk them through it. I have a few ladies that say, Jeanette, as soon as you walk in here, get it over with. And so I do the pap smear first and then I do everything else, right? Because those ladies are so fearful of the pelvic exam that we literally get that done first so they don't have to think about it throughout the entire rest of the exam.
Right.
So if that's what you prefer, then ask for that, right? This is your exam. This is your time to talk about your body and what you have questions about, right? So is it going to hurt? I can't say it's not. I mean, if there's issues, like if you have an infection, right, it might hurt. If you have what we call atrophic vaginitis, where when we start losing estrogen, that vaginal tissue it hurts to stretch, right? It hurts to kind of even like place a finger near that vaginal opening. So if you do have that, yeah, a pelvic exam is going to hurt. But I think the more open you are with your provider and just telling them how you feel and how you're nervous, I think that will lighten the mood a little bit
Right.
and let them know how you feel. Right. And I would rather a patient tell me that they're nervous rather than not. And I act like they're totally fine with this and just do my normal exam. There are other ways that I personally use lidocaine, right? I have lidocaine in my drawer. So if you're really nervous, I will do what we called, remember earlier, we talked about the bimanual exam where I do a pelvic exam with just one finger. I actually place the lidocaine lube.
Tube.
Place that lidocaine on my finger. And when I do the exam, I'm actually placing lidocaine in the vaginal area. So then I let that sit after I've done that exam, and then I place the speculum. A lot of women do really well with that, and that can actually help the pain of the exam. So don't be afraid to ask for that. Okay. That's something that a lot of us have in our clinics that we can help you with that.
Right.
Mm-hmm.
I think another reason people are scared to come in is because there's this level of embarrassment.
Mm-hmm. Mm-hmm.
And I think it's a good reminder that this is what we do for a living.
Absolutely.
And we've seen
A lot of vaginas.
a lot of them.
Mm-hmm.
And at this point, you don't even really
No.
see it.
I don't
right?
know you by your vagina.
Right.
I'm going to know you by, oh, your kid just went off to college. How are you doing? I'm so sorry. I know you just dropped her off or you just dropped him off. How are you doing? I remember those conversations. I absolutely don't remember what your vagina looked like.
Yeah.
I don't. And I think that's a good thing because you don't need to be afraid to come and see me because you're worried about what I'm going to think of your vagina.
Right.
I'm there to help you.
Can we just sidebar?
Mm-hmm. Sure.
And
of course. We're good at that.
The bush is back.
Oh, the bush is back. It is back. And I think it's totally crazy because it's totally dependent on the person. And you never know what you're going to get, right? Are you going to have a bush? Are they going to be shaved? Is it going to be waxed? Is it going to be lasered? Oh my God, no, we're not going to tell them my laser story.
Oh my God, please tell your laser story.
It's so embarrassing. Oh
okay, we're going to do it.
Oh my
Okay,
God.
so I
Oh.
went and got laser done far before Jeanette did. And I was like, this is great.
Mm-hmm.
And first I started with just like my underarms. And then I was like, okay, I'll move to my bikini line.
Mm-hmm.
And then finally my laser girl was like, you should just go the Brazilian. Just do it. And so I did. And I had like a really good relationship with my laser girl. So she was always just like very kind to me, never uncomfortable. So then Jeanette tells me, I'm getting laser for the first time and I'm a little nervous.
Okay, so Brittany's like the best friend in the world. She said, okay, schedule it on a day where I can go with you and we'll go have some cocktails. So we went and had lunch and we had a few cocktails and it was really great because it calmed me down. And then she took me to my laser place.
Hold on, you're forgetting a part of the story.
Okay.
So then let me bring it back. I wanted to tell her this is how it has happened for me. So when I got my Brazilian and she was doing the backside, oh, my brother's going to love this.
Oh, here we go.
So she would just kind of lift up my leg and then just find the area that she needed to. And then that was it.
Okay.
The Brazilian part was done.
Sounds easy.
Yes.
Mm-hmm.
And so this is how I explained it to Jeanette. You just lay on your side and that's how she does it. And
That's
then
easy.
That's very easy. So then Jeanette walks into her laser appointment and
Oh God. So I'm nervous, but thankfully after a few cocktails, I felt like I could do this. I could tackle this. So my laser girl, so nice. If you're listening, shout out, but so nice. But we got done with the front part. And that was totally fine. It was not painful. So if you're afraid to do laser because if it's going to hurt, it doesn't hurt. Okay. And then she was like, okay, I need you to roll over on your stomach. And I was like, what do you mean? And she said, I need you to roll over on your stomach and kind of go up and kind of lift up and kind of go up on all fours. Oh my God, guys. I about died. My heart was going so fast. I started sweating and I was like, this bitch lied to me. Brittany lied to me. I thought I just had to roll on my side and lift my cheek up and she would do that really intimate area. No, that's not what happened at all. So I came out because Brittany was there and I am red, right, Brittany? Like
yes.
I look like.
I thought that I didn't know what had happened.
I was embarrassed.
Yeah, you were very embarrassed.
And you're like looking at me, and she obviously knew it was something was wrong. And so I went to schedule my next appointment, and I'm thinking to myself, why am I even scheduling this? You know what? I'm just going to lose the money. I'm never coming back here. Forget it. We're never doing this again. So Brittany's like, what is wrong with you? And I was like, just give me a minute. And so we walked out, and I was like, you lied to me. And I proceed to tell her the story, and this bitch cannot stop laughing. I mean, Brittany.
Okay, well, you're smooth now. So
I am smooth.
Yes, you're smooth. So no complaints there.
But now I'm smooth and the bush is back.
Yes, I know. You're. Who knew? Who knew?
Okay, so if that's TMI, you can just like press go forward a little bit on the podcast. And now you know a little bit more about me than you did before. So you're welcome.
Oh, God.
So anyways, obviously the embarrassment part, which we touched on. I think it's important also that people are afraid of a diagnosis. And I think that happens with a lot of times in medicine, right? I know that there are so many people that when I was doing primary care that wouldn't go to the doctor because they were afraid of being diagnosed with something.
Right.
Well, that's what you go to the doctor for, is to make sure you don't get diagnosed with something. So getting a diagnosis is great if it's done early, right? The last thing you want to do is get a diagnosis and it's too late. So earlier you come to see us, the earlier we can diagnose, which then the earlier we can treat. So I think it's obviously something that people are fearful of, but they still need to do it, right? They still need to go and be seen. And then maybe like the lack of control, right? As
Absolutely.
women,
Yes.
kind of the lack of control of what somebody else is going to be doing to their body during that moment, especially with any history of sexual abuse. And I think it's important that if you've had a history of sexual abuse, you talk about that with your partner before, or your provider and your partner, but your provider before that pelvic exam. Because sexual abuse does a number on our body, not just physically, but mentally too, and what it can do during a completely benign and safe pelvic exam, and you're not really thinking it's going to do that, and what can happen during that exam. I think it's important that you bring that up prior to that pelvic.
Right. If you've had a history of sexual abuse, if you're not comfortable with your provider, then you can move on. Just know that, because I think sometimes I'll talk to people. Well, this is outside of work, and they just say, I haven't been able to vibe with my provider, in whatever specialty. You have choices, right? And don't feel like you're stuck, because I think that also contributes to why people don't come, because they don't like their provider, or they didn't feel comfortable that one time or listen to. That's probably the biggest one,
right?
I didn't feel like I was listened to.
And I think people think, I don't want to hurt their feelings if I go somewhere else. What? It's not about that. This is your body. Not about if you're going to hurt my feelings if you go see somebody else. No, I want you to be comfortable with whoever you see, so you get the best care that you can possibly get. I think there's also like myths, right? Like that people don't need pap smears or annual exams for certain reasons, right? So I have some patients that say, well, I got the Gardasil vaccine, so I don't need a pap smear.
Wrong.
Especially because it only covers 9 different types of HPV. And if there are other types of HPV, there's a bunch of different types of HPV that can cause cervical cancer and other types of issues. So you still need a pap smear for that. You still definitely need a pap smear, even if you've been vaccinated. And then also I have some people that say, well, I'm not sexually active anymore, so I don't think I need a pelvic exam. Definitely still need a pelvic exam, because there's more than just pap smears with a pelvic exam. Do you maybe have a pelvic floor issue? Do you have urinary incontinence? Are you peeing on yourself when you sneeze, laugh, or cough? I mean, pelvic exams can help with all kinds of things like that. And then I have other patients that say, well, I'm done having babies. I don't want to have babies anymore, and I'm past my reproductive years, so I don't need one of those anymore. Well, that's not true either, right? Like we talked about earlier, I've had ladies even at 45, 55 be diagnosed with abnormal pap smears or find abnormal things on pelvic exams. So still coming to see me, though, even though you're out of those reproductive years, is important.
Right.
And then, just talking about emphasizing, the importance of keeping up with these exams, because this is where we talk about other screenings. Like, when do you start mammograms? Well, most of the time it's 40, right? Just in case you didn't know that. So all of my ladies that are turning 41 with me, if you have not had a mammogram yet, get out there and get a mammogram. But mammograms and colonoscopies and any other type of screening that you need specifically for your family history or your personal history, that changes. When you need a mammogram changes on your own family history. So talking about all that is important and making sure you're on a good screening regimen. And I also think that it's important that you have a good provider that can create that empathy, right? And a supportive environment for you. I don't think enough of us have that as women, anyways. I don't think there's a place that we can go that we have that empathetic provider that talks to us and is like, hey, look, we're doing this together, right? And I think that's important for us as providers to provide that for our patients. Like, hey, you're not the only one in this. I'm right there with you, girl. We're going through this together. I still go to get my pap smears. You still go to get your pap smears sometimes. Okay.
It's getting scheduled.
Oh, scheduled. Yes. That's what she says. And then I want you to feel empowered to ask me those questions. What questions do you think about during the day that you're like, man, I really want to know about that? But that's your time to ask me those questions. We might not be able to get you those answers at your annual exam, but I can set you up for tests that I can run, ultrasounds, blood work, and I can have you come back and we'll go over all of that in detail so I can get those questions answered for you.
Right. And if you're one of those people just who's highly anxious or just in this certain situation, you feel more anxious than usual, bringing in someone for support, whether that be your partner, a friend, somebody that you feel isn't going to be judging you, I guess. I don't know if that's why people, what adds the anxiety when you go to things is I'm going to be judged by this provider.
Yeah.
Am I going to be judged with the person that's with me? If you can bring someone that's supportive and can make you feel more at ease, by all means.
I love that.
Yes.
I have
it's another set of ears. Because sometimes you're being told things and you forget them.
Right.
Like I remember when my mom was going through some of her health stuff, we would record, even though there were 3 sets of ears there. I would record and listen to it over again because sometimes you just get overwhelmed. You get overwhelmed with the amount of information, or you get overwhelmed by the heaviness of what you're listening to.
And you're a medical provider, right? And you have education on all of that. Imagine a patient that
I know the big words. I know what the big words mean.
Right. And a lot of people don't.
Yeah.
And so having somebody there that even if they don't have a medical background, they're just your best friend, or they're just your cousin, or they're just your mom, or even your spouse to come in there with you. A lot of people have that. They have that supportive person that allows them to just be comfortable there. And I think that's great. I think it's really great. So yeah, I think, a lot of people say, well, how do I prepare for this? Especially my young girls, right? Who've never had a pap smear, my 21-year-olds who are coming in for that first exam. How do I prepare for this? Well, you just write your questions down and you take a shower and you come see me and we chat about all the things. And I walk you through a stirrup. What is a stirrup? Where do you put your feet? How far do you have to scoot down at the end of the bed? And I'm going to be honest with you girls. You think you're all the way down on that bed. I'm going to need you to scoot down like 3 more scoots
because you're going to fall off.
Yes, I won't let you fall off. You're always not far enough down. And I know you feel like you're going to fall off. And I know you think your stuff is all up in my face, but it's all good. Just keep scooting and I'll tell you when to stop. Okay. I think it's great that there are these providers out there that allow people to be open with them and be comfortable with them. But I think you as the patient need to have that power to ask those questions. So please ask the questions. Stay calm and write them down if you have to, but ask the questions, okay? And go to those exams. So as far as pap smears, I think it's important to understand that the results usually take anywhere from 7 to 14 business days, depending on the lab, honestly. There are some labs that take a while to come back, but most pap smears come back pretty quickly. That allows us time to review them. That allows us time to make a plan for you. So giving your provider anywhere from 1 to 2 weeks to get those results and the recommendations back to you is pretty normal, I think. Definitely pretty normal. What else did you have questions on? Anything?
I can't really think of anything right now.
Okay.
You've done it. You've done a great job.
So you're going to make that appointment?
Yes.
Okay.
Yes.
Okay, guys. So on to the things I need to tell you. This information provided in this podcast is for general information and educational purposes only, and it's not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare providers with any questions you may have regarding a medical condition. There is no provider-patient relationship formed during this podcast. Never disregard professional medical advice or delay in seeking it because of something you have heard on this podcast. The hosts and producers of this podcast do not assume any liability of the application of the information discussed. Reliance on any information provided by this podcast is solely at your own risk. And remember, if you do have questions about any of this that we've talked today, and you just truly want to be a fly on the wall and send us an email, we would love that. We got a few emails recently, and those have all been answered, and we would love to hear more. The email is questions@lubetubepodcast.com. Just shoot us an email, and either myself or Brittany will get back to you as soon as we can. Thanks again for listening. Thanks again to Celebrations for being such an amazing sponsor for us. And I truly, truly love that y'all are listening in. It really means the world to me. And I know it means the world to Brittany too, just having y'all here for us and listening to what we got to say.
Absolutely. I want to say this before we end. We have plans for our next episode. Should we tell them?
I think so.
Okay.
I think this is going to be a big one. I think this is something that a lot of people are like, oh, I don't want to talk about that. Ooh.
So yes, our next episode, what we plan to talk about is painful sex.
Yes, because guess what? You are not the only one that is having painful sex.
Ouch.
I know. So yeah, let's talk about it.
Okay.
All right. Thanks, guys. We look forward to talking to y'all soon. Have a good one.
Bye.
Bye.